Good morning, everyone. Welcome to Rutgers University and the Rutgers School of Public Health. My name is Perry Halkitis. I'm Dean of the School of Public Health. I'd like to, let's take that. I'd like to welcome you all here this morning, and particularly to welcome Congressman Frank Pallone. In Washington, D.C., he was among the leaders who spearheaded an effort to provide $8.3 billion in emergency supplemental funding to fight coronavirus. With us here today also is the Mayor of New Brunswick and Senator Smith and various experts in the field. And I want to say, I want to say offhand that it is incredibly important as we continue to fight this epidemic that we think about this multi-sectorial response. Government officials working with public health officials, working with infectious disease specialists, combining all of our talents together is how we're going to fight this disease. We saw this morning that the stock market closed because it was crashing. And so this virus doesn't affect one aspect of our lives, but all aspects of our lives. And with that in mind, I'd like to introduce the Chancellor of Rutgers Biomedical and Health Sciences, Chancellor Brian Strom, who's on the television, who is a very good public health person because he was not feeling well. And he has decided to join us today electronically. Chancellor Strom.
Thank you, Barry. Good morning, everybody. And I apologize for not being there in person. I spent the weekend with my granddaughter who was sick, and she was generous enough to give me her virus. I didn't think you will necessarily want a comparable gift. So good morning. For those of you who only know me as Chancellor, I want to make clear I'm also a general internist and clinical pharmacologist, and especially relevant to today, an epidemiologist. So the issue we're here to discuss today is dear to my heart and background. I'm also Executive Vice President for Health Affairs for the university, so our preparedness plans are of great interest to me as well. And we have other experts here from Rutgers in addition, who are part of our Emergency Operations Center. And all of us are available to answer questions as we proceed. But first, before opening the meeting to questions, it's my distinct honor to welcome our distinguished guests to Rutgers. I'm pleased to be joined here today by Congressman Frank Pallone, Senator Bob Smith, Mayor Brian Wahler of Piscataway, School of Public Health Dean Perry Halkitis, and Dr. Misha Malhotra from Rutgers Robert Johnson Medical School. Although well, we're in the midst of a global outbreak of the COVID-19 coronavirus. Given that, it's vital that leaders from science, medicine, and government all work together to ensure the health and safety of our population. Today, you'll hear from leaders of those communities. As a public institution, Rutgers is a key health resource for the state. The New Jersey Poison Information and Education System, located at Rutgers New Jersey Medical School, is serving as the state's COVID-19 call center. Members of the public can call the hotline at 1-800-222-1222 for assistance in multiple languages 24 hours a day. In addition, Rutgers scientists are leading efforts with the protein data bank to image and study three-dimensional models of acute coronavirus enzymes. Such work, we hope, will lead to a better understanding of how to stop the virus. Our scientists at New Jersey Medical School are also hard at work to develop a new, better, faster point-of-care test for the virus as soon as possible so that physicians can do tests for the virus in their offices. These are just a few examples, but I can assure you that our researchers are working hard to address this outbreak as are our clinicians, and they will continue to be a key partner for our state and for federal agents. It's now my pleasure to introduce Mayor Brian Wahler of Piscataway, who wanted to make a few statements, and in turn will introduce Congressman Pallone. Thank you.
Thank you, Chancellor. First of all, I want to thank everybody for coming out here to the School of Public Health today on a very urgent issue. At the local level, mayors across the state are ready and willing to implement whatever directives that come out of the Department of Health and the County Department of Health. This is a team effort, and we're working in conjunction with the federal government also. People have to remember whatever directives do come out, they will be implemented at the mayoral level. As always, we are prepared, at least in Piscataway Township. We have set up our Senior Citizen Center as a mass inoculation site. if and when that ever comes to that. I'd like to say that the general public is heeding to a lot of the press reports and directives from the public health departments around the state. I had an opportunity this weekend to attend about 6 houses of worship, and number one topic was the virus. But I was happy and pleasantly surprised that all the houses of worship were practicing proper practice in regards to health and watching, not shaking hands. People are actually using hand sanitizers coming into the house of worship. And I think that is half the battle, that we at the local level, if the general public would listen to some of the suggestions that respective departments of health are giving out to their residents and follow them, that we will have a fighting chance in this. I also, at the mayoral level, is very concerned about, as I was speaking to the congressman before and the senator, that this will have a revenue impact upon communities across the state. Most towns and cities are getting ready to introduce their 2020 budgets within the week. We have lowered our revenue projection levels by almost 50% when it comes to the hotel industry. That is just not something we're doing lightly. After seeing what's going on with some of the hospitality industry, losing substantial amount of cancellations across the state, that has a direct correlation on finances for most municipalities in the state and the state of New Jersey. So we will continue to work with the county health departments, the state health departments, in conjunction with other state officials, and obviously through the federal government with Congressman Pallone's help, to see that we get through this. We've been through other events before, and I'm sure we'll manage it as long as everybody rows in the correct direction. I think we have a good opportunity to lick this at some point. The folks at public health field will come up with something for all of us in this country to deal with. But more importantly, I want to thank Congressman Pallone for being here today and raising the issue out there and doing a great work through as chairman of the Energy and Commerce Committee, which has jurisdiction over public health issues in the United States. And I want to thank you for all your hard work that you're doing, and your staff keeping in touch with all the local towns and cities in your district in regards to this matter. Thank you, Congressman Pallone.
Thank you, Mayor. Thank you so much, Mayor. And, first of all, I want to mention that, first of all, thank Rutgers for being our host today, and particularly the School of Public Health, which has played such an important role in this issue. But the fact that we have the mayor of the town, that we have our state senator, that we have our officials with Rutgers and the School of Public Health, that's on purpose, because we want to point out that this is a multifaceted approach that we need, involving public health, university, and elected officials at every level of government. So I was very pleased to see some of the statements that Mayor Wahler made about what's happening here at Piscataway, and we'll hear from Senator Smith about what's happening on the state level, which is very important. And I think also, they've done a good job in terms of trying to alert the public about what's going on and what needs to be done. What I plan to do as quickly as possible is basically outline, if I could, what the federal government did, particularly last Thursday, when we did the supplemental appropriations bill, and what kind of money and what that money is going to be used for. The president signed the bill, I think on Friday, certainly over the weekend, so it is law, and that money should start going out. I'll also, go through some of the common sense things that the CDC recommends, which you've probably already heard, but I think they need to be repeated. And then I wanted to give a little bit of an update on what we're going to do from here, because we go back into session today. I'll be traveling down to DC, and both Nancy Pelosi and Senator Schumer had I don't know if they had a press conference or they put out a press release talking about sort of the next steps that need to be done by Congress beyond the appropriations bill. So let me just let me just outline a bit about the supplemental appropriations bill that was passed and signed into law by the president. It's a total of $8.3 billion. $3 billion of that is for the development of treatments for a vaccine. Treatments and a vaccine. And there's $300 million to ensure that Americans will have access to the vaccine regardless of their ability to pay. The issue of how people are going to pay for things is very important, and that's part of what we're going to talk about this week in Congress, and I'll outline that before I finish. But this package of $8.3 billion protects against price gouging of medicines developed with taxpayer funds, because it says that the federal government will only pay a fair and reasonable price for vaccines and drugs, and provides HHS, Health and Human Services, with the authority to ensure that these drugs or vaccines are affordable. Again, this is a big issue. It provides $2.2 billion in public health funding for prevention, preparedness, and response, and $1 billion specifically to alleviate the financial strain on local hospitals and health systems like community health centers, because I've been hearing from the hospitals, of course, about the financial strains. It also protects public health by allowing Medicare providers to extend telemedicine services to seniors regardless of where they live. There's about $500 million for that. You know, we talk a lot about telemedicine, particularly for those people who are hard to reach. And of course, now, because you don't want to spread the virus, it becomes more important. But we have a lot of restrictions on the use of telemedicine and how it's paid for. And we're trying to get rid of those restrictions with this initiative. And then it also, lastly, supports small businesses impacted by the epidemic, allowing for an estimated $7 billion in low-interest SBA loans to those affected. So I'm just giving you a broad outline of this, but I think it's important that I talk about it. I just wanted to make a few sort of general comments. You know, I'm trying not to be critical of the Trump administration, because I don't think that's useful. But the president, as you know, makes all kinds of crazy comments and does provide a lot of misinformation, and that's only increased by the misinformation that's on social media. So, but I do have a lot of faith in the federal agencies, and so to me, it's very important that you have faith in the federal agencies to carry out their job. And I just wish that the president and the and the vice president, even though he's in charge of this, I think that it's very important that they not politicize this. And so therefore, you know, see what the federal agencies tell you. I'm not saying don't listen to the president, but I think that if you can listen to the federal agencies, they're mostly civil service. They do know what they're doing for the most part. And when we talk about what we're doing in Congress with the legislation or the other things that I'm going to talk about today, let me emphasize that we are looking at the science. We're not talking about politics. Nobody's trying to be, you know, the Democrat or Republican. Everything that we do, and that bill that I mentioned, is totally based on the science and what's happening with the experts in the scientific community. And I did want to also say that I do think that the governor and the state legislature are doing a good job of what they're doing here, and so we'll hear from Senator Smith about that. But just a few more things in terms of just kind of public service announcements. If you have any questions, assistance is available over the New Jersey Department of Health phone number at 1-800-222-1222 or online at nj.gov/health.gov. So that's out there. You can also visit the CDC website at cdc.gov for more information, the Centers for Disease Control. And again, listen to your public health professionals. Now, I wanted to talk a little bit, well, I guess I don't mind. I'd like to repeat this. I know you've probably heard this a million times, but I would like to repeat the CDC's recommendations, again, if I could, about everyday preventive actions, which include avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth with unwashed hands. I got to be particularly careful about that because I'm always touching my face and my nose. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. And of course, individuals who are sick should stay home, should cover their cough or sneeze with a tissue, then throw the tissue in the trash, and clean and disinfect frequently touched objects and surfaces. I know you've all heard this before, but I do think it's important to repeat it. Now, the last thing I wanted to mention is, where do we go from here? Because as I say, we're going to go back today into here. I just touched my face. We're going back today to Congress, and we and Speaker Pelosi and Senator Schumer I believe yesterday announced a series of things that we're going to be looking at, but I did want to mention them again. And most of this now deals with the concern that people won't have the resources, right? That people can't afford to pay for things, or maybe they don't have health coverage, or maybe their health insurance doesn't cover a lot of things, and so they worry that maybe they shouldn't be tested or they shouldn't go to a doctor because they're not going to be able to pay for things, or their copay is too high, or their deductible is too high. So what we're going to be looking at right now, and what we've said that we want to do is address paid sick leave. So workers impacted by quarantine orders or responsible for caring for children have to receive paid sick leave to alleviate the consequences of lost wages. Enhance unemployment insurance so that those benefits are available and sufficient for workers who may lose their jobs from the economic impacts of the epidemic. Food security, look into expansion of SNAP, WIC, school lunch, and other initiatives because of potential weakened food assistance programs for vulnerable people. And then clear protections for frontline workers, clear standards and sufficient distribution of necessary protective equipment for healthcare and other workers who are in contact with people. Widespread and free coronavirus testing. This is the most important. People feel they're going to have to pay for the tests. Even if they're sick, they're not going to want to have the test. So we want to see what we can do to make sure that the testing doesn't cost anybody anything. And then affordable treatment, that patients would be reimbursed for any non-covered coronavirus-related costs, because if not, they're not going to be treated and the virus spreads. Anti-price gouging protections, so that things don't get out of hand in terms of the cost. And then increased capacity of the medical system to use our emergency response mechanisms to mobilize resources. And that goes back to you, because I'm sure you've got first aid and other emergency workers. So these are the things that we're going to be looking at this week, in addition to the supplemental bill that I already mentioned. And with that, I'd like to turn it over to Senator Smith, who represents this area, and he'll give us some background on what the state is doing, which I think has been good, very good, Bob.
And just very, very briefly, but as everyone in this room knows, our Department of Health at the state level is coordinating the readiness of our hospitals. Unfortunately, I think they're going to be tested like they've never been tested before, and the education of our population about the very things that CDC and Congressman Pallone just mentioned, the things that you do to help to prevent the spread. In the legislature, there's a number of bills that are going forward, and I think will be quickly passed. The chief author, which is Senator Joe Vitale, who is the chairman of the Health Committee on the Senate side. As you know, state governments define Medicaid, what procedures, payment, et cetera, under the Medicaid program. Senator Vitale has a bill in to make certain that all of the virus-related expenses are covered in our Medicaid program, and that there will be no copay. As the congressman mentioned, one of our biggest concerns is that you're going to have people not taking advantage of the testing procedure because of the cost. So the state of New Jersey will very quickly change our Medicaid rules, and likewise, Senator Vitale has legislation that will make certain that our private insurers will do the same thing. No copays on it, and that the testing and treatment procedures related to the virus are covered under the medical insurance policies of the state of New Jersey. I would urge, especially after hearing the congressman indicate this is going to be a new bill, that we be prepared for the unintended consequences, stuff nobody's even thought about. So, for example, he mentioned the fact that food insecure people are going to be very much at risk in this, in what is going to happen as a result of the virus. I'm sure you don't know how many children in the state of New Jersey receive food in their breakfast program, or school lunches, or other food insecure people receive food assistance, but it requires that you gather. And if schools shut down for any period of time, all of a sudden there's no food. So I would urge him to definitely get that in the supplemental. In this area, we have Elijah's Promise, which does an excellent job of helping food insecure people. but there's gonna be new ways that they're gonna have to deliver food and make it available to people. And those are things that are in nobody's budget, nobody's planned for them, because this really is a historic moment where we're having a public health crisis that nobody really has seen before. I'd like to thank Congressman Pallone for his leadership on this issue.
You know, it's a wonderful thing that we have a very prominent New Jersey congressman leading the effort. He knows the area well, and I know we're going to
Get the job done under his leadership.
Thank you, Bob.
Congressman, if I may, before I turn the mic back over to you, one of the challenges we're having here at the local level is just getting masks for our first responders. As everybody knows, you go to the local stores, and there's been a run on supplies. Well, the first responders are the ones that are going to be helping the community out. So if they don't have it, that presents a big problem. Because I know we tried to attempt to put an order in for 5,000 masks within the last couple of weeks, and you forget about it. There's none to manufacture. So unless they're in some warehouse vault in this country, you're not going to get it. And so if the towns and cities across, at least in the state of New Jersey, can't get basic minimal protections for their first responders, how is the general public going to get it? So that's a big question. So, and I want one last thing about the school districts. I know the school districts are working with the Department of Education and the state in conjunction with the state health department on the policies and procedures moving forward if and when do they get to that stage that they have to have school closing. So Congressman, let me turn this back over to you.
Thank you, Mayor. And we're going to turn to the health experts now. We have two physicians here very much involved. But just in terms of what my two elected colleagues said, Senator Smith is right. When I went through that list of things that Schumer and Pelosi talked about for this week, it is anticipated that there will be more supplemental appropriations bills to respond to those very issues that I mentioned, both at the state and local level. And I should say, you know, big issue, I'm sure it's going to come up with the questions, is masks and the diagnostic tests, and basically, you know, what, you know, I guess I should say, every day in Congress for the last 2 weeks, we've had either a briefing with the federal agencies or a hearing in our committee on these issues. And, you know, so and that's going to happen again today, this evening, back in DC. And it constantly comes up about pushing out these, you know, diagnostic tests and the mask. And all I can say is we're trying to get that stuff out as quickly as possible. But let's turn to our two experts, if you will. First is Dr. Amisha Malhotra, who's assistant professor at Rutgers Robert Wood Johnson Medical School, and basically deals with infectious diseases. Doctor?
Thank you very much, Congressman. First of all, thank you for inviting me. I think this is wonderful that we have our public health officials here, and we are coordinating as a group. We need our public health officials, we need our medical professionals, we need our to help to best give all of you the information that you need to deal with this. And I understand that this is a big concern. On the medical front, I want to put a little perspective on this. If you're sick with a fever and a cough and a cold, it does not mean that you have COVID-19. Remember, this is respiratory viral season, okay? And there are many viruses that are circulating. So yes, there's a concern, but also remember basic things. This is what we tell you for all respiratory viruses. If you're sick, please stay home for all respiratory viruses. You know, just as our chancellor has been doing, which I commend him for saying, hey, I don't want to spread my germs. And that's what we're asking you to do. If, you know, when you're sneezing or you're coughing, please cover your cough. We know that droplets go from the person who's sick out to the public. Okay, so use common sense. Please wash your hands. And again, for any respiratory virus, any virus, it's important to keep our hands, which we use to touch everything. And then what do? We touch our face and we touch our noses, right? And that's how those viruses get in. And the other thing is, please keep up to date on vaccinations. And I'm going to remind you that the flu vaccine is still very important and And all of us that have not been vaccinated and that can be vaccinated should still be vaccinated. We're still seeing influenza A and B. And again, like I said, I want to put something in perspective. In the United States this season, we've had over 18,000 deaths from influenza, okay? 105 pediatric deaths from influenza in the United States. So I'm trying to keep things in perspective here. I absolutely not belittling the issue of what's going on with COVID-19. But again, when people ask me, what do? I say, well, have you been vaccinated? Have you had the flu vaccine? That's one less virus to worry about, in my opinion. Okay, and again, you all have heard what we need to do. Our prevention is try to follow that as much as you can. People ask me about face masks. We, our first responders, our medical professionals, are the ones that are going to be seeing the sickest people. So we definitely need those face masks. When the public says, do I need to wear one? I'm not a big fan of a healthy person going out there and wearing a face mask. I don't think it does much for you, okay? And what I do find people do is they're constantly adjusting these masks, touching their face and their nose. Okay, so wearing a face mask for someone who's very healthy and doesn't have any symptoms just doesn't make a lot of sense. I think we need to save those for the people that are seeing the sick people and using it for them.
Thank you. So next we have Dr. Mitchell Rosen, who's director of the Center for Public Health, Workforce Development, and basically deals with preparedness. This is all at Rutgers School of Public.
Correct.
Right.
Thank you.
Thank you, Congressman Pallone. Glad to be here today to add some thoughts on emergency preparedness and planning. As Mayor Wahler said, planning is local, and the work that our local health departments are doing in terms of surveillance and monitoring and reporting is essential to community preparedness and preparedness for dealing with this outbreak and other things that happen all the time that we don't see because our frontline workers are doing the work that they're doing. When thinking about community preparedness and emergency preparedness, we should think about how we do risk assessments and what's the situational awareness. What can happen? How likely will it happen? And what are the consequences of it if it happens? So we need to look at different scenarios, the intensity of things, the severity of things, and the impact of it. And then weigh the consequences of action versus non-action. Community partnerships are important, and many before me have talked about that. And communication and coordination between agencies, the public, academia, medical care, and others is essential. And I think communication is really essential because we need to get out consistent, actionable messages that are based on science so that one agency isn't saying one thing and another agency saying another thing, so that we're keeping the message on track. Emergency operations coordination needs to take place. We need to look at business continuity. How do we continue to do the things that we need to do and protecting our workers and those who are in our partners in business. Risk communication is essential. Who are the ones that are going to be issuing the public information, the alerts, the warnings and notifications? How do we share information? Who are the stakeholders that should be incorporated into the information that is being shared? And what are the guidelines that we have and the standards for information exchange? I talked a little bit about surveillance and epidemiology. We have our local health departments and the state health departments, the federal government doing public health surveillance, conducting those epidemiological investigations, and looking at the different type of mitigation actions that need to take place. Something that's near and dear to my heart is responder safety and health. We do a lot of training for emergency responders and public health professionals in all realms. And we need to look at ensuring that our responders are safe and healthy as they're doing this. As part of the $8.3 billion, I think there was $10 million that was appropriated to NIEHS, the National Institute of Environmental Health Sciences, for worker training programs. So continuing the things that they've been doing for many years and dealing with the risk here to COVID-19. Looking at the responder safety and health risks, how do we keep the responders safe as they're responding? Without a safe workforce, then we don't have the people to do the response. And when we talk about, preparedness in, say, the hospital, this goes from everybody who's in the hospital, from the people who are cleaning the rooms to the physicians, nurses, and everybody. They're all on the front lines when they come to this, so ensuring that everybody is kept safe. Volunteers are involved in emergency planning. How do we recruit, coordinate, and train them? And then looking at some post-pandemic recovery and transition, how do we return to normal? Looking at the replenishment of stockpiles and assessing the effectiveness of our plans and procedures. I think there are some things that Washington should be looking at putting in place an emergency temporary standard for infectious disease to protect our workforce, so that OSHA has something to say that you're required to follow the CDC guidelines. When we're talking about respirators, it's not so easy just giving people respirators and say wear it. They need to be trained how to use it. They have to be fit tested to ensure that it's properly fitting so that they're properly protected, and they have to wear it properly. So those are some of my thoughts on emergency preparedness, and I'll turn it back to Dean Halkides.
So I'm just gonna wrap it up here for us and then open it up for questions. I do wanna just make some concluding comments. First of all, I wanna thank Senator Smith, Mayor of Piscataway Wahler, and Congressman Pallone for being here. I think it's very easy to think about public health and politics as being separate, but they're not separate. And good politics that put people at the center, that puts the public at the center, is ultimately what's going to get us there. So thank you for the three of you for your leadership in this regard. Number two point I'd like to make in conclusion here is that we have to, and I hope we're modeling here, how we're going to get through this epidemic is through open and transparent conversation about what we're all doing, and with data that are accurate. It is no longer acceptable to lead this epidemic based on whim or what we think or what we feel. Science has to lead the way here. Science combined with compassion and with technology. And having said that, I just want to leave us with one final thought. This is a virus we're dealing with, but we're dealing with human beings. And human beings are more than biological agents. They are emotional agents, and they're social agents. And they always don't make rational decisions. And we have to lead our efforts with that very much in mind. So we have to continue to educate the population about the virus and its prevention. We have to address the anxieties and fears that are out there because people have them. And if we make believe that people are just going to make logical choices and are going to make the right choices all the time, we're going to be very incorrect in that assumption. Fear, anxiety, hate, those factors will keep people from being healthy, and these have to be fought as much as the virus itself. And we have to effectively advocate for the people who become infected with this disease. The virus is not the enemy, right? The virus is the enemy. People are not the enemy. And if I learned anything from my years of doing HIV work, that is probably the most important message. So I'm glad several of our students are here also. This is a learning opportunity for all of us. Collectively, I am an optimist. We will get through this together, and we will come out on the other end on a great side. So thank you all very much for being here.